Today we are going to look at some of the common hepatic disorders that we are likely to encounter in the emergency department and think about their pathophysiology, clinical presentation, management and complications. So we'll start with a 34-year-old male patient who presents to the emergency department with abdominal pains, vomiting and fever. On an examination, he is noted to be jaundiced. These are his liver function tests. So you can pause the video and have a look and decide what you think is going on here. So when we look at the enzymes, we'll notice that his alkaline phosphatase is very high and his other enzymes are normal or close to normal. When we look at the bilirubin, he has a marked elevation of his direct bilirubin with not much elevation of his indirect bilirubin. This picture suggests obstructive jaundice, and these are some of the more common causes of obstructive jaundice, particularly choledocholitis and carcinoma of the head of the pancreas. In this patient with obstructive jaundice, if we have signs of biliary obstruction with dilatation and he has fever, we need to think about ascending cholangitis. Another condition which presents with a cholestatic picture is intrahepatic cholestasis. And this is where we have a cholestatic picture on biochemistry, but no dilatation of the extrahepatic biliary system. And causes can include viral or alcoholic hepatitis, certain drugs, particularly oral contraceptive pill, but also some antibiotics, for example, some of the macrolides, and pregnancy, as well as some other conditions such as sickle cell disease and sepsis. The second case is another patient with jaundice, and when we look at this blood test, what we notice is that the ALT and AST are markedly elevated compared to the alkaline phosphatase. So this is hepatocellular jaundice. Here are some of the common causes: hepatitis, hepatocellular injury, for example due to alcohol, and then other causes of hepatic dysfunction. You need to know that the AST to ALT ratio has traditionally been used to differentiate between alcoholic liver disease compared to viral liver disease. Patients with a AST to ALT ratio more than 1, and particularly those with an AST to ALT ratio of more than 2, are likely to have alcoholic hepatitis if they present with a hepatitic picture. Here are 3 infections that can cause jaundice that you really do need to know quite a lot about, particularly for your Part 1 exam. Viral hepatitis, leptospirosis and dengue. And this slide gives a brief comparison of the 3 conditions. So you may want to pause the video and have a closer look at this slide. It's really important that you know these 3 conditions and the comparisons between them. With viral hepatitis, we need to understand the different types of viral hepatitis, how they present, how they're transmitted, and what complications may arise with each. In addition, we need to know how to interpret hepatitis serology, and this is particularly important for hepatitis B infection and distinguishing between acute and chronic hepatitis, and in particular chronic active hepatitis and carrier states. Again, you may want to pause the video and have a little closer look at this slide to tell us the difference between these different states. Along the same lines, we also need to understand the classification of dengue by severity according to the WHO. This slide shows us the main differences, and we now talk about dengue with and without warning signs and severe dengue. Case 3 is another patient with jaundice, and in this patient what we notice is a very high LDH with normal liver enzymes otherwise. This is hemolytic anemia. Hemolytic anemias can be divided into congenital, autoimmune, and mechanical causes. We have another presentation on anemias that goes into this in more detail. So, when it comes to the classification of jaundice, we talk about prehepatic, hepatic, and posthepatic jaundice, and this gives us a bit of a summary of the 3 types of jaundice and what can be expected. Again, this is something that we need to know in some detail. One more case, a 48-year-old alcoholic who presents with persistent vomiting and confusion. He has stigmata of chronic liver disease. He also is noted to have a flapping tremor and mild confusion. He's jaundiced and has moderate dependent edema. So this is a picture of hepatic failure. If we think about the functions of the liver, detoxification, protein synthesis of clotting factors, hormone metabolism, glucose homeostasis, and bile synthesis and excretion, we can think and understand the presentation of liver failure. So patients may present with confusion because of a buildup of toxic metabolites. They tend to be hypoalbuminemic with edema, have easy bruising and bleeding because of the lack of clotting factors, may have gynecomastia because of abnormalities of hormone metabolism, are prone to hypoglycemia because of the abnormalities of glucose homeostasis, and may be jaundiced. Common precipitants include alcohol, non-compliance with medication. So these are precipitants in patients with chronic liver disease. Gastrointestinal bleeding or infection, hypokalemia or hyponatremia, the use of sedative hypnotic drugs, diarrhea, vomiting, and dehydration, or sometimes patients who have shunting procedures for portal hypertension develop hepatic failure as well. And our treatment really is focused on resuscitating patient, correcting hypoglycemia and other metabolic abnormalities, and treating the underlying cause, whether it be infection or gastrointestinal bleeding. Where appropriate, we may also think about correcting the coagulopathy. So that was a very brief look at liver conditions that you might encounter in the emergency department. If you have any questions, you can bring them up in class. We looked at jaundice and liver failure. The one other topic that is worth looking at for your part 1 is chronic liver disease, both cirrhosis and chronic hepatitis. Thank you.